Hi everyone, I'm Dr. Shiva Raya, and today we're in Central Park in New York City, and I'm with my friend and colleague of 18 years, Dr. Abhi Raviraj, who's a Senior Emergency Registrar in Queensland. Today we're going to be talking about strokes, a fairly serious topic. So thank you for joining me on the video today, Abhi.
Thank you for having me.
Alright, my first question is, what is a stroke, and what are the two broad classifications for the types of strokes that there are?
So a stroke is where you lose blood and oxygen supply to a portion of the brain. There are two types, one being an infarct, where you have a blood clot within a blood vessel that stops blood from flowing to that part of the brain. The second is a hemorrhage or a bleed, where you have free blood within that brain tissue. It also, however, stops blood and oxygen from being delivered to those brain cells.
And what symptoms can a stroke cause?
So this is varied for different people. Commonly, it's a loss of function, either motor or sensation loss in the face, in an arm, in a leg. It can also be a speech impediment. It can be an inability to swallow or new visual disturbance.
And if someone thinks they're having a stroke, or a family member thinks that the loved one is having a stroke, what should they do?
Call an ambulance. Get to hospital as soon as possible. It is imperative that you get there as quickly as you can to see if we can stop that irreversible damage from happening.
And you don't advise that people drive themselves to the hospital or get a family member to drive them, do you?
Absolutely not. Get to hospital, call an ambulance to do that. Do not think you can drive yourself, and don't get your family to get you there.
And how important is the time period in terms of treatment and trying to prevent irreversible damage?
It's critical. You need to get to hospital as soon as those first symptoms start. There are things that can be done, certain procedures. What we typically say is between 3 and 4.5 hours. Up until that point at some facilities, you can do certain procedures to stop that irreversible damage. Some facilities will do this up to 24 hours, but come to hospital as quickly as possible.
Okay, and in terms of preventing strokes, there are a few things that we can look at in the years leading up to it, so things like cholesterol, diabetes, hypertension. What are the other risk factors?
The other risk factors are similar to ones for helping your cardiac health. So quit smoking. If you're not a smoker, great. Drink less alcohol, doing lots of exercise. These things are very important to preventing stroke.
That's really great. Thanks a lot for your advice and help today, Abhi.
No worries. Thank you for having me.